Assalamu alaikum warahmatullah. You are going to start the final year clinical rotation, which is surgery 2 course, and it is the final step in your journey to clinical mastery. And this semester is composed of 18 weeks in the total duration, and it is divided into two intensive clinical rotations, each one 8 weeks, and it's composed of 6 credit hours with 1 hour theory and 5 practical. So in a total of 215 hours, we will have only 7%, which is 15 hours theory, and most of it is practical. And the 200 hours are dedicated entirely to practicals, small group tutorials, clinical rounds, each round about 3 hours. You'll have a total of 24 clinical rounds and problem-based learning and discussion. And this problem-based learning and discussion in groups, small groups, tutorial groups. And your primary textbook, we have to emphasize that your primary textbook in this course is the patient. So the next 8 weeks, your patient is your book. The three pillars of clinical practice as examination, interpretation, and formulation of the diagnosis at the end. So examination, you had the basis of taking history, doing clinical examination, starting from the third year, semester 5, 6, and even you practice this more coming through your last fifth year. And now you are going to master this art of interviewing and doing clinical examination in our patients. And also you are required to do interpretation helped by your tutors to accurately analyze the clinical laboratory and imaging findings. So we always say when you meet the patient, you take history and you do examination, you before even reaching examination, you have differential diagnosis. Then when you complete your examination, you have a final working diagnosis. Based on that diagnosis, you will request your required investigations, either labs or radiology and other investigations, endoscopy. So it depends on your patient. So then you are going to formulate and you have or you prove your diagnosis. And as we mentioned repeatedly, a quick, correct diagnosis is very important and is a pillar in your management, especially in emergency situations. So this is a teaching triad in clinical rounds. As I mentioned, you have 24 clinical rounds with hands-on on patients, and you have also 24 clinical surgical clubs covering all the aspects of general surgery, emergency, elective conditions, and also subspecialties, making basics of these subspecialties like urology, plastic surgery, neurosurgery, and vascular surgery. And you will repeat all these things are repeated. You can see the condition in the round, discuss it in the surgical club, and further discussion in tutorials. You have about 20 tutorials per shift. So you will go through all the pathology matrix, the GI system, the endocrine, breast and other endocrine areas. Thyroid is the main condition, the common disease that we have in our country. And as I mentioned, other specialties like urology, vascular, neuro, and pediatric surgery, which is an important component in our teaching. And as you know, young and pediatrics, they comprise a significant percentage in our population. And also some endemic disease, you will have a focus on mycetoma. And as far as we have one of the best two or three centers in the world in our hospital or teaching hospital, you will see many cases and many varieties of some endemic regional diseases, especially mycetoma and regional complexes like diabetic patients and other conditions. The surgical club is coming through all these basics of surgery, fluid electrolytes, pre-operative and post-operative management, principles of surgery like shock and others. Then multiple injuries, chest injuries, abdominal, all types of injuries you will have. We will discuss it in details. And in acute emergencies, we'll see all aspects of acute emergencies, acute abdomen bleeding, upper lower GI bleeding, and acute urinary retention. And so you see it is mixed in including other specialties. So we emphasize on all emergencies because you will be in the front bench treating these patients, and you are the first doctor to receive them in the emergency department. So you have to know, and you have to know how to start the emergency treatment and which doctors that you need to consult and call urgently. And also the basics of other specialized things, the foundation for advanced surgical subspecialties like plastic, organ transplant, surgical oncology, and cardiac and cardiopulmonary surgery. So this is an overview for our course, and prepare for the words. We need you to review your anatomy and to polish your clinical interviewing skills. This is an important step firmly to do the role of a clinician, and welcome in our course surgery too. So let us begin now. Thank you very much.